Hi, so today we're going to be looking at multifidus and its activations. So we're going to be doing 2 in standing and we're going to do 3 in quadruped. These muscles are super important. They concentrically load every time we inhale. They're therefore really important for making sure that we can build intra-abdominal pressure correctly and therefore important for our core stability and back health. Okay, let's have a look at the drills. As with any muscle activation, it's very difficult to target those muscles specifically without activating other ones at the same time. But this is going to encourage these muscles to work a little better and we can focus in on them a little bit more than some of the other ones that we're using. So we're going to do 2 drills in standing. The first one we're going to be facing the wall. So we're going to place our hands up on the wall, either nice and neutral or maybe a little bit of a lean in depending on how much support you need. We're going to use our breath. So we're going to breathe in. There'll be a little bit of an anterior tilt as you do that, that's absolutely fine. We're going to brace in that position and then we're going to take the leg back. It's important that you hold that intra-abdominal pressure whilst you're in this position. We're going to hold for 5 seconds, we're going to bring back in and we're going to exhale. We're going to breathe in, take it back, hold, and then bring the leg back in and exhale. So you can do that for multiple reps and you can do that on both sides. There should be no pain or discomfort when you're doing this. Obviously, if there is, just let me know. The second drill we're going to do, you're actually facing away from the wall. You want to be about half a foot width away from the wall. You can either use your hand with fingertip pressure if you're a little unstable, or you can do it without. Exactly the same thing. So we're going to breathe in, we're going to brace, we're going to use this side to begin with. We're going to take that back. We're going to make sure the leg stays locked straight and we're going to push it back into the wall. We're going to hold that for 5 seconds and then come back and exhale. So those are our 2 standing multifidus activations. We're now going to move into quadruped in the next section of the video. Okay, so the multifidus activations in quadruped, we're going to do 3 variants of these, but they all start off in the same position. So we have our foot tripod engaged, our knees directly underneath our hips, hands directly underneath our shoulders. With our feet, we're going to give a little bit of rotation so that the little toes are engaged. With the hands, we're going to give a little bit of arm rotation to make sure that the little fingers are fully engaged. Hand tripod also engaged, and we're going to push the ground away. So we don't want to be in a slouch position like this. We want to push the ground away. Head is in a nice neutral position with our gaze fixed firmly in front of us. We're going to work with our breath. So same as we've done before, we're going to breathe in, slight anterior tilt as we do so to the pelvis. Fill the abdomen with air, and then we're going to brace. So breathe in, brace, we're then going to lift a knee. Okay, so we want our pelvis to stay nice and neutral. We're going to lift that knee ever so slightly off the ground. We're going to hold that for 5 seconds and we're going to pop that back. We're going to do that for numerous reps and we're going to do that on both sides. To progress the exercise, we're going to add a little bit more weight to the leg and we're going to do that by extending it out behind us. Now when we do this, we need to make sure that the brace is strong, so the intra-abdominal pressure remains strong throughout the activity, otherwise you're likely to hyperextend your back. You'll end up kind of doing this and compromising your back rather than working the muscles that we're trying to target here. So again, screw in, breathe in, brace, lift, out, nice and straight behind you, hold that for 5 seconds, bring it back down and in, and then exhale. Again, repeat multiple times, both sides, and then we're ready for our next progression. So, exactly the same, screw in, take a breath in, brace, lift, make sure that's in place, lift, that's in place, hold for 5 seconds, bring the arm down, bring the leg down, re-engage the foot tripod and the hand tripod, and exhale. Again, you can do this multiple times. Let me know how you get on.